Thanks so much, and I want to thank you all for the opportunity to present here, and I'm really happy that we're all focusing so much time and attention to disparities because they are such an important issue in our community as well as across the nation. So as I talk about this, the one thing I want you all to keep in mind is in Hurricane Katrina, almost half of those who died due to the hurricane were above the age of 75. So just sort of keep that in mind as we're talking about this. I have a pretty ambitious agenda, so I'm going to go pretty quickly, but I'm happy to address questions at the end. I want to introduce the concept of public health emergencies, define it, talk about public health preparedness, in other words, what we usually do to prepare for them, how the law is important, and talk about older adults in this context and why they're disproportionately affected in public health emergencies. And then I want to leave you all with some things to think about in terms of opportunities and next steps. In other words, what can we really do to improve outcomes for these folks in a public health emergency? So what is a public health emergency? Well, generally it's any event that overwhelms the routine health capabilities and capacities of a community. So the cause is really a little bit less important than the consequences. And there are a series of variables that determine whether an event will rise to the level of a public health emergency. These include the resources available in the community, the resources that would be needed to address the needs of the community in case of an event, how predictable the event is, its scale, its timing. And public health emergencies tend to have a potential for morbidity and mortality surges. Now, we usually can think of public health emergencies as being caused by several different types of factors, whether they're naturally occurring or human caused or some sort of interaction of the two. So naturally occurring, we might think of extreme weather like extreme heat, or we might think of drought or tsunamis or volcanoes or earthquakes. And there's some argument about whether humans are, perhaps exacerbating some of these things, right? So there's some possible interaction there. And some of these events are caused purely by humans, right? So when we think about conflict and war and mass shootings, and I know we just spent some time talking about firearms, so those are all human-caused potential public health emergencies. And we all in this country use an all hazards response approach, which basically means that regardless of the cause, we're going to try to treat these emergencies similarly because often the consequences are similar on our healthcare system and on our capabilities and capacities. So through laws and practices, we basically try to think about how we're going to deal with a public health emergency through planning. And our emergency management system is really all about how do we plan for these things, right? And that's kind of a tall order because some events are predictable and some events aren't, but it's in many ways kind of the best we could do, right? So we plan, we exercise, and what I mean by that is we do drills or we have other types of thought experiments where we try to think about where our gaps are and how to get rid of those gaps. And then we also respond in an actual public health emergency. And through both the drills or the exercises and the response to real emergencies, we try to modify how we respond. We try to learn lessons so that next time we'll maybe do a better job. Public health emergencies really require a lot of different skills, and that manifests in many different ways. And one of those is the interaction of different government agencies in different sectors. So typically what will happen is an emergency management agency will coordinate planning efforts and also coordinate response efforts, but other agencies will be responsible for specific tasks in planning and response. For example, a transportation agency, whether it's at the local level or at the state level, will typically be responsible for evacuations, while a public health agency may be responsible for alternate care sites, and a human services agency may be responsible for sheltering of the population in case that's necessary. And what I want to emphasize is that this requires working together, and that's another theme we've sort of been hearing through some of the talks today. It requires these various sectors working together horizontally, meaning the local government agencies all working together, as well as vertically. So the local government has to work with the state government and the federal government. Generally, in one of these public health emergencies, the locals respond first, and if they're overwhelmed, the state comes in with additional resources, with additional help, and if they're overwhelmed, the federal government comes in. So I just kind of wanted to give you all a quick background there. So the folks who are well versed in preparedness and better versed than I am, would like to think of this preparedness cycle, where we're going to prepare for these kinds of emergencies by trying to think ahead and plan and try to get resources ready and have agreements ready and have laws that are going to facilitate our response, and then respond in an actual event where we're actually concerned about getting folks out of a particularly dangerous situation or getting folks the care that they need. And then there's a recovery phase where we try to get back to the status quo, back to what our community was like before a public health emergency occurred. And through mitigation, we really try to make sure that we're better prepared for the next one. In other words, we're less likely to be affected by a similar public health emergency, or if one occurs, we're going to be less impacted by its consequences. So public health preparedness is really shaped by a lot of things, but one of those things is law. And I kind of want to highlight some of these, some of the ways in which that happens, because I think it's really important to the rest of our conversation and how it impacts the elderly. So just a few things I want to highlight. There are laws at the state level, for example, that require professionals that see patients to report certain infectious diseases, right? And we are basically saying that we're going to give up some of the confidentiality and some of the protections for those individuals because we're really interested in monitoring those diseases to make sure that we don't have a community-wide problem that needs to be addressed. So law is really important in the prevention stage, and also in an actual public health emergency, it's really important too. There are laws at the federal level and at the state level that deal with emergency declarations, how they can be declared, and more importantly, what that means, what the consequences of that are. For example, many state laws say that in a declared emergency, what can often happen is that governments can spend extra funds, or they can suspend regulatory provisions that under normal circumstances would be operating. It also, in emergencies, when they actually occur, we also kind of shift some of the ways that we normally do business, right, and how we think about the law. A good example is how is controlling property, right? So normally when the government takes private property, they have to pay the person who owns the private property. But in this kind of public health emergency, let's say you have some property that's contaminated. If the government seizes that property, they actually don't have to compensate you. And that's just one example of the way in which we sort of suspend our normal operations and the normal principles that control when we don't have a public health emergency. Laws are also responsible for controlling folks in order to prevent and address public health emergencies. So things like quarantine laws and laws that try to institute other control measures to make sure that infectious diseases aren't spreading as quickly. There are laws that institute mutual aid agreements to try to work out some issues between different jurisdictions to share resources. And there are laws that try to encourage folks, especially those with a healthcare background and a medical background, to be good Samaritans and to provide aid in an emergency by protecting them from potential liability in case they provide assistance to folks. So what I really want to highlight with you all is vulnerable populations, which is a term that a lot of us have been talking about, right, and how the elderly fit in a public health emergency. So vulnerable populations in this context are basically those that can't comfortably access and use available resources in an emergency. And I want to emphasize that the elderly, especially if we define them as 65 and older, are a really heterogeneous group, right? And there are lots of possible reasons why folks that are over 65 might fit under this definition of vulnerable population. It could be a sensory impairment, it could be a cognitive disorder, it could be a limited English proficiency or poverty or multiple chronic conditions. But the idea is that there's a lot of overlap in the two groups, and that vulnerable populations really need some extra help, which is not something that our public health preparedness system is really based on, right? For instance, we're all supposed to have 72 hours worth of food, water, and medicine so that if there is an emergency, we can take care of ourselves for the first 3 days. I don't know how many of you all have that. Nevadans, based on a recent survey, for instance, of 14 states, were actually least likely to have those kinds of resources available. So that's fine and dandy for those of us who aren't in this vulnerable population group, but for some folks, they need extra help, right? And the elderly, some elderly folks fall into that category. So really quickly, just wanted to show this information here on our demographics in Nevada and compare those to the US to show that we have lots of folks who are 65 and older that are living in dependent facilities, and we have lots of folks who are 65 and older that are living with disabilities, even though those numbers are slightly lower than in the US overall. So in a public health emergency, there are lots of possible ways that the elderly can be impacted. And whether or not an X goes in some of these rows can kind of be debated, right? But if we have independent, semi-independent, and dependent elderly, which is really a question of how much assistance they need with activities of daily living, and also a question of whether they're living in a community or in some sort of healthcare facility, there are various factors that make a lot of elderly folks more vulnerable. So some of the reports suggest, for instance, post-Katrina, there were lots of folks who were targets of fraud and abuse, lots of issues connected to social isolation. If you're in a healthcare facility, you're going to be more likely to be susceptible to communicable diseases within that facility. You're also going to be at the mercy of the facility's response planning efforts. So I just kind of highlight this to sort of demonstrate some of the issues that the elderly are likely to face in a public health emergency. And we really need to be thinking about them as we plan for these kinds of things to affect our state. Fortunately, there are some laws that are there to help us. I want to emphasize that most of them are federal laws, and most of them really focus our efforts on planning, which kind of makes sense, right? Because in some ways, that's really all we can do, right? Especially with an event that's unpredictable, right? But I'll sort of get to some other recommendations in just a couple of minutes. So really quickly, the Older Americans Act, which creates a network of organizations that essentially at the federal, state, and local level are really there to support seniors, requires planning efforts by those organizations. And I'm going to fly through a couple of these other ones as well. So the Americans with Disabilities Act. There are lots of folks, as we saw in Nevada, who are 65 and older that have disabilities. The ADA prohibits discrimination against those individuals that have disabilities in government programs at the state and local level. And there have actually been some court cases relatively recently finding that some localities like the city of New York, the city of Los Angeles, have not sufficiently provided for these populations in their planning efforts. How that shapes up, we'll have to see as the definition of what is sufficient takes shape. There are also other laws that tie planning efforts to federal funding, and the Pandemic and All Hazards Preparedness Act is one, which allows the Health and Human Services Department to require funded entities to describe how they will plan for this population and work with local aging agencies to do so. Some states also have specific laws focusing on vulnerable populations. Most don't have laws that focus on the elderly. Most focus on kids or people with service animals or people with pets. And there are none in Nevada that focus specifically on elderly folks. So what can we do? This is according some recommendations from the CDC, basically try to think better about what the elderly are likely to face in a public health emergency and try to anticipate some of their needs, trying to figure out what our laws say, what our authorities are to deal with this population in a public health emergency, and try to really plan better. So again, this heavy emphasis on planning. One state, I just want to provide an example, Florida, and Florida is unique in having this law actually created by law, by statutory mandate, local registries of individuals who need special evacuation or sheltering assistance, and the law requires that the local governments provide for these folks and that government agencies and healthcare providers help with enrollment. And it requires all people that fall into this category of needing assistance that are receiving state or federally funded services register with this kind of system so that we can know who needs help and how to help them and how to access this population. And the last thing that we can do is really invest in our public health system, because the healthier our public health system is overall, the more resilient we'll be overall, and the more able we will be to provide for the needs of this population. So just one quick example, if we have interoperable communications, we're more likely to respond faster to an emergency and be able to provide for this population. And there are plenty of others that I'm happy to talk about later in more detail. Thanks a lot.